Namaste and welcome to this important program to launch the National Mental Health Campaign in Nepal to all of our viewers, young people and older people everywhere in Nepal who can join us today. The pandemic has placed an untold burden on all of us, especially children. Children in Nepal and all around the world have witnessed terrible suffering, lived in fear, been deprived of their classroom learning and robbed of the everyday joys of playing with their friends, spending time with their extended families, and just being a child. Families have been pushed into poverty, and the knock-on impact this has had on increasing child marriage, increasing child labor, abuse, and gender-based violence are emerging everywhere, including here in Nepal. This campaign comes at a critical time for Nepal, as Nepal is one of the countries with the highest proportion of children living with mental health conditions. The global data suggests that 10 to 20% of children suffer from mental health issues. Young girls, in particular, are suffering in silence. Suicide among adolescent girls has increased by a staggering 40% during the 4 months of the COVID-19 lockdown compared to the same period the previous year. UNICEF just launched the State of the World's Children flagship report, which this year focuses on mental health issues of children. Our most comprehensive look at the mental health of children, adolescents, and caregivers in the 21st century. In it, we find that there are insufficient systems in place to provide children with the support they need. Young people are telling us that every adult needs to be aware of the negative impacts of mental health issues on children and young people, especially those living with disability and from the LGBTIQ community, so that all of us together can collectively create a safe and supportive environment for the youngest. Which is why UNICEF is calling on governments and public and private sector partners to urgently invest in mental health services across all areas, including health, education, social protection, and beyond. To integrate evidence-based solutions across the health, education, and social protection sectors in all of our interventions and all of our programs, and critically to break the silence surrounding mental illnesses. This World Mental Health Day, and as we begin to celebrate Dashain in Nepal, let's work together to ensure a happier, healthier, and more understanding environment for everyone, including our children, every child, every boy, and every girl. And a message to young people struggling with uncertainty and hopelessness. Don't suffer on your own. Reach out to someone you trust and let them know what's on your mind. It can be hard to open up, even with people you trust, but it's the first step to getting the support you may need. Our sincere thanks goes to the government of Nepal for leading the National Mental Health Campaign we launched today, and to all the wonderful partners who are working tirelessly every day to try and help young people, children everywhere across Nepal to feel better and get the support that they need. Wishing all of you happy Dashain and Dhanyabad.